Hi everyone, my name is Nicole. Today we're going to be talking about bruxism, the causes, effects, and treatment options for bruxism. What is bruxism? Bruxism is the habitual grinding or clenching of teeth. It can occur while you're awake or during sleep, and more often than not, people are not even aware they are doing it, even when they are awake. It is associated with stress and other lifestyle factors. Here's a fun little picture showing clenching and grinding of teeth back and forth. Signs and symptoms of bruxism include worn down teeth, flattened or chipped surfaces. Um, Bruxism can cause tooth sensitivity that's due to enamel loss, which leaves open like our pulpal space, the dentin, which is not as thick as the enamel, and just can cause a lot of issues, such as jaw pain, headaches, and tight facial muscles. Just as an example of how this can cause jaw pain, I want everyone right now to clench your teeth together as hard as you can. We will count to 30 together and release it. After we release our jaw, I want everyone to feel just how tense and tight those muscles are just for that 30 seconds. And then think about how people feel who do it habitually overnight. Most people sleep 8 hours overnight, and they could be clenching and grinding that whole 8 hours. We're just going to be doing it on a small scale for 30 seconds. So, everyone, let's bite our teeth together. I will let you know when to release. All right, let's go. All right, go ahead and relax your jaw muscles. You notice how tense it feels in your temporomandibular muscles, in the temporomandibular joint, the TMJ. Um, for mine, it feels very tender, and I can even feel it in my back teeth as well. I, however, am one of the people that is a habitual bruxer. Every night I clench my teeth when I get frustrated or I'm concentrating, I clench my teeth, and I definitely have the signs and symptoms of being a bruxer. Moving along, effects on our teeth. Enamel erosion, which exposes the sensitive inner layers, as we touched on earlier. It can cause cracks and chips, which weaken the tooth structure, which later on down the line, those cracks and chips, they can actually break off and your tooth can break, which will expose more of that inner pulp, which causes a lot of pain and sensitivity. This also increased risk of cavities and dental pain. You can get on the top, especially on your back molars, what I've heard referred to as potholes in your teeth. And those are a really good spot for tooth and for food and other matter to just get in there in your tooth. And it's really hard to get out. And as we all know, if you have food stuck in your teeth, it can lead to decay, which can cause cavities and all sorts of other issues. Um, Here is a picture showing the grinding down of the top of the teeth, and it is showing the different layers of the tooth. And just how, I mean, this is kind of an extreme picture, but it can happen. Just how grinding your teeth can really flatten out your tooth and expose those inner layers. Um, Bruxism seems to affect about 10 to 30% of the American population. According to some quick internet searches, I found all sorts of conflicting information, but the general range seems to be 10 to 30%. I will say from my short time working in a dental clinic, every single patient that I saw in the chair, I could see signs of wear from grinding and clenching. And I think it was probably about 75% of the patients that came in there were recommended to get a mouth guard, a night guard to kind of help stop the grinding at night, which we will touch on the night guards later on in the speech. Effects on the TMJ, or the temporal mandibular joint, and the muscles associated with it. There's all sorts of TMJ disorders, also known as TMD. It can cause joint pain and dysfunction, such as popping, clicking, or cracking of your jaw. You can also get lockjaw, where your mouth gets stuck open, which does not sound very fun to me at all. You can get headaches, earaches, and jaw clicking are very common. Chronic grinding leads to muscle fatigue and spasms. Moving along. Bruxism can also affect the periodontal and the structures associated with it. It can damage the periodontal ligament, which helps secure the tooth in the socket. It can lead to increased tooth mobility, and it may contribute to periodontal disease progression, such as bone loss, which also our teeth are inserted into the bone. And if you have bone loss, they're not going to be as secure in their sockets as they would be without bone loss. There is many different causes of bruxism. Stress and anxiety are major contributors. It is also linked to ADHD and parasitic infections in children, interestingly enough. The theory behind the parasitic infections in children is that parasites affect our neurological function. So part of the neurological functions being affected would be like an overstimulation, just a reaction of clenching that jaw down tight as a way of coping with things. It's a pretty interesting topic. There is also different lifestyle factors, medications, and genetics may play a role as well. Bruxism can happen day or night. It can last days to months, years, a lifetime. When it lasts into the months is when it becomes a problem. It can cause by stress, is probably one of the main contributors. You clench your jaw and grind your teeth. Luckily for us, there is a couple of different treatment options. You can get a custom fitted night guard to protect your teeth. Physical therapy is also another big one for jaw relaxation and addressing the muscles of the TMJ. You can also go to therapy for CBT to address stress and anxiety issues. Here's a picture of what a typical night guard looks like. They're thicker plastic, so they can hold up to the forces of the grinding and clenching. There's also different medical interventions that people can seek as well. There's muscle relaxants that can help reduce nighttime grinding. Botox can weaken overactive jaw muscles. Then there's also anti-anxiety medications that can also help manage those symptoms. Bruxism is common in children, and it's sometimes linked to the parasitic infections, which we touched on earlier. It may also be associated with ADHD, and it is important to monitor and manage at an early age. In conclusion, bruxism can severely affect oral health and your quality of life. Early detection and comprehensive treatment are very crucial. Combining therapy yields the best results. Thank you for listening to my speech on bruxism. I hope you all learned a little something today and were able to take away something that can help you in your everyday life. Thank you.